Let's break down hypothyroidism for the NCLEX. We're going to cover exactly what you need to know, nothing more, nothing less.
Whoa, stop scrolling for a second. Hypothyroidism is definitely on the NCLEX, and if you get a question on it, you have to know these key priorities. Let's make sure you get it right.
So what is hypothyroidism really? Well, at its core, the thyroid just isn't pumping out enough T3 and T4 hormones. This basically slows down the body's entire engine, its metabolic rate, and that slowdown, you guessed it, impacts every single body system you can think of. Okay, for signs and symptoms, I want you to burn this into your brain low and slow. Everything is low and slow. The heart rate, low and slow. That's your bradycardia and hypotension. How does the patient feel? Low and slow. Lethargy, fatigue. Even their gut is low and slow, leading to constipation. And with a slow metabolism comes weight gain and that classic cold intolerance. See? Low and slow.
Do not let the NCLEX trick you with this one. In primary hypothyroidism, the thyroid gland itself has failed, so the pituitary gland is working overtime, literally screaming at the thyroid by pumping out tons of TSH. That's why TSH is high. But in secondary, the pituitary is the one that's broken. It's not sending the signals, so of course, TSH is going to be low. You got to know the difference. So, an NCLEX question asks for your first action. What do you do? Think ABCs. Circulation is a huge priority, so you're monitoring for that dangerous hypotension and bradycardia. Then, you've got to ensure a patent airway, especially if you're worried about myxedema. And finally, remember, their metabolism is super slow, right? That puts them at a huge risk for medication toxicity. You have to give all drugs, especially CNS depressants, with extreme caution. This is a massive, massive safety alert. Your patient is going to tell you they're freezing cold, but you can never, and I mean never, give them an electric blanket or a heating pad. Why? Because their sensation is so decreased, they can get absolutely horrific burns and not even feel it happening. The NCLEX loves to test this. Warm blankets only. That's
Now for the medication, Levothyroxine. These teaching points are non-negotiable for the exam. Number 1, it has to be taken on an empty stomach first thing in the morning for it to absorb properly. Number 2, this is a lifelong therapy. They can't just stop. And maybe most importantly, they have to know how to report signs of hyperthyroidism, because that's a huge sign their dose is way too high. And that brings us right here. If there's too much levothyroxine in their system, it's not some minor side effect. It literally flips the patient into the exact opposite condition. So toxicity looks just like hyperthyroidism. We're talking a racing heart, tremors, feeling hot all the time, anxiety, all those classic high and fast symptoms. Okay, this is the ultimate red flag. Myxedema Coma, this is what can kill your patient. It's the most deadly complication of hypothyroidism because all of their body systems are just shutting down. And what's the number one killer here? Respiratory failure. They literally stop breathing. This is a true medical emergency. So if your patient is in a Myxedema Coma, what's your priority? Airway, airway, airway. You need to be ready to secure their airway, probably with mechanical ventilation. Next, you give Levothyroxine IV, not PO, because their gut is too slow to absorb it. Then you support their blood pressure with IV fluids and warm them up slowly with blankets. Again, never heating pads. All right, you ready? Let's do a quick NCLEX check. The priority lab in primary hypothyroidism is... That's going to be a high TSH. Remember, the pituitary is screaming at a thyroid that just won't listen. Okay, next one. Levothyroxine toxicity looks like what? Yep, hyperthyroidism. Tachycardia, heat intolerance, all of it. And last one, a huge safety risk you absolutely have to prevent is burns. Absolutely no heating pads, no electric blankets. It's all about that decreased sensation. You totally got this. Make sure you save this video for your NCLEX review and follow me for more high-yield content just like this.